Again, Linda, thank you very much for coming online and sharing your expertise here. Really appreciate it. And looking forward to hearing more from you in the future. And thank you, InterSystems, again, for all the great work InterSystems does in the healthcare system. And next up, we have the CEO and founder of Click Therapeutics, coming off a major announcement last quarter with Boehringer Ingelheim licensing deal, and one of the leading DTX groups out there actually in the front lines doing this stuff. David Klein. David, thank you for joining us today.
Thanks for having me, Stan, and it's a pleasure to be at HitLab again.
Wonderful, yeah, and really, JPM Week, as you know, you're a regular participant these days, having gone a few rounds of funding and done startups in the past, was massive. It was virtual. It seemed like everything happened anyway. All the big meetings were going on around the main JPM meeting. What were some of the things that you heard, and what do you see happening based on that in 2021, not just for Click, but for the ecosystem, for digital health in general?
Yeah, look, I think, the kind of virtual nature of JPM was probably indicative of kind of our industry going more digital and more virtual, which was really a trend that was happening even before COVID, but that's been kind of massively accelerated. So I think that there's been an increased attention on digital and on, just generally what we're doing, especially as it gets, you have to be more and more innovative to reach patients or customers or physicians. All of those stakeholders are obviously have gone virtual.
Yeah, without a doubt. And we had a lot of that with the virtual first, and the impact group, which is now spearheading an industry associating in virtual first. And for Click, a lot of talk has been made around data, and artificial intelligence and machine learning using that data. Tell us a little bit about Click and where Click is going on that level and within that frame.
Sure. I think, in our view, data and our approach to data is a real differentiator. I think where kind of our angle is that, unlike many kind of digital health companies that are really focused on reducing costs, or, there's another bucket of, let's say, digital therapeutics companies that are focused on improving outcomes. We have a strong focus on utilizing data to both improve outcomes, but also to reduce costs. So I think, that's really our view on data and on personalization to make sure that every patient has a engaging and effective experience, but while also using that data not only to improve the overall cost of care, but to prove the overall cost of care is improved. So,
yeah, and that sounds lockstep with what patient centricity, which is our next panel coming up in a few minutes with Lee Shapiro and 7Wire, and their focus of their fund is around patient-centric products and services in digital health. And so, 2021, we're looking at this pandemic dragging on for at least another 6 to 8 months. Some people, notably Professor Lipkin at Columbia Medical Center, one of the leading infectious disease docs, saying it could be another year or so. How does what you're doing really help with the outcomes and with the patient-centric model, remote care for patients? How has it helped them?
sure. So, well, there's been I would say, a kind of rapid adoption of just the credibility behind the thesis that, someone can be treated remotely and digitally, right? So people have been much more kind of apt and keen to use these types of programs and to try to seek help in their own home and really on their own time. So as people have shifted to digital and kind of have gained a new respect for healthcare in digital, as many people are seeking their healthcare on their computers or mobiles, there's been a newfound really fervor for using apps to get treatment or to be treated in and of itself. So it's kind of bittersweet for our industry. It's something that we've always believed would happen, just a bit slower than it is now. And how we're directly helping. I mean, not only have we been kind of ramping up commercialization of Clickateen, our first commercial program very significantly. But as it was publicly announced, we also have a program partnered with Otsuka for the treatment of major depressive disorder, and one can only imagine how important that is in these days, right? So let's say a program is shown to be a first line treatment for major depressive disorder, or a treatment for major depressive disorder, and something that can be accessed and utilized really in one's own home on their own time. I think there's no more meaningful time than to have a program such as that than now. And I could go kind of across the board with all of our indications. I think that just in the time of COVID has really served to exacerbate many of these different indications, but also really encourage people to adopt digital. So
Okay, fantastic. Thank you, David, very much for just a tremendous insight and just wonderful information about what's going on. Thank you.